My name is John Pasi. I'm Professor of Haemostasis and Thrombosis at Barts and the London School of Medicine and Dentistry in London. And I'm going to talk about a presentation that we gave at the WFH 2020 Virtual Summit on the 4-year follow-up data of BMN 270, a gene therapy for haemophilia A. As I'm sure many of you know, BMN 270, otherwise known as Valrox, is an AAV5-based gene therapy that contains a B-domain deleted human factor VIII codon-optimized construct. This has been studied in a phase 1/2 program, which initially commenced back in 2015. So I'm going to talk about today 13 patients that were in this trial. There were originally 15 patients, 2 treated at lower doses, but these patients didn't produce sufficient levels of factor VIII. The 13 patients I'm going to talk about were treated at either 6E13, 7 patients, or 6 patients at 4E13. Of all the patients that went into the study, all but 1 were on prophylaxis, and the mean bleed rate prior to going into the study was significant at 6.5. What we saw and have seen over the years, over 3 and 4 years, is a dramatic reduction in bleeding that has been consistent. The 6E13 cohort has been followed now for 4 years, and the bleed rates have come down to an ABR of less than 1. The 4E13 cohort has been followed for 3 years, and similarly, there's been a dramatic reduction in bleeding. All the patients are off prophylaxis, and spontaneous bleeds have only been seen in the 2 patients who've expressed the lowest levels. As you'd expect, with a dramatic reduction in bleeding, there's been a dramatic reduction in the need for factor concentrate, which in the 2 cohorts has been reduced by 96%. The treatment that has been used in the last year has essentially been used to cover procedures such as joint injections, knee replacements, dental surgery, aside from the 2 patients at the lowest levels who had a number of bleeding events. What we've seen, if we look at the clotting factor levels, is a slow and shallow decline in clotting factor results over the last year or 2, which is following on from the data that we previously saw. When we look at the actual treatment that has been required over the last 5 years, we see this continued dramatic reduction. And as I mentioned, in fact, only 2 patients have had bleeding problems of note over the last year. The 3rd patient that bled was a patient who had 2 traumatic bleeds, one jumping from a bridge onto a boat on a river, and the other injuring his ankle playing football. All the remaining patients have had no bleeding events. So what we've seen is continuing over up to 4 years now, essentially massive reduction in bleeding. In terms of safety, the treatment has not thrown up any new adverse events that would be worrying. The initial trial showed ALT rises in the first year, which were treated with steroids, but these have shown no long-term sequelae. And there have been no new treatment-related adverse events. There are a couple of patients who were qualified as serious adverse events as they had knee replacement surgery, but no treatment-related serious adverse events. So looking at it overall, this is really positive data going out to 4 years, which is now the longest data that we've got for haemophilia A. And we see in both cohorts ABRs of less than 1, and effectively all patients are off prophylaxis and continuing to have these really low bleed rates, if not a bleed rate of 0. The program continues its very favourable safety, and I think that this data, though showing a shallow decline, of factor levels is very promising for the long-term future of these patients, and also for the phase 3 studies which are in play at the moment.